Hi, I'm Chris Hasty. I've been practicing here in Greenville for the past 15 years. Initially trained up at Duke University for medical school, then did my residency at Campbell Clinic as well as my fellowship, which is in Memphis, Tennessee. And I've been practicing here since I finished my fellowship. Since I've been here over the past 15 years, one of the reasons I did orthopedics is because I do like taking care of younger folks as well as older folks. And one of the things that kind of called my name was doing sports medicine. And so when I got here, I started to get involved with the high school athletics, and I've been taking care of high school football and basketball since I've been here. I was asked to start helping take care of East Carolina University about 12, 13 years ago now, and so I've been one of the team docs with East Carolina now since I've been here. It's funny, you can talk about sports medicine and you can talk about the surgery of sports medicine, and I think a lot of people can do that. I think it's more what I like is being involved with the athlete. I love seeing them go from being injured to being better and being happy, and that's an aspect of sports medicine I enjoy. And then I've also been asked before to take care of the Kinston Indians. And what was really fun about that is that translated into also taking care of Cleveland Indians during spring training. And well, you know, I see people all the time that come in the office and they say, well, you know, I'm a really active person. And so whatever they're doing, whether they're playing tennis or whether they're playing basketball, in my mind is equally as important as that college athlete that's playing, because they're doing it because they enjoy it. They enjoy it because it's keeping them active. And I think that's equally as important as any college or professional athlete. When I got here and started getting involved with my practice, that naturally progressed into being involved in the hospital, getting to know people at the hospital, and it's given me the opportunity to get involved in several of the committees. I've been president of the Pitt County Medical Society, very involved in several committees in the hospital. Used to be trauma director. I've given that to one of my younger partners at this point, and more involved in the politics. You know, it's not that being politically active is a lot of fun, but I do think that if you're involved in the process, you understand medicine better, and that makes you a better doctor. And it gives you a better understanding when things can be made better. You can help with that process. I've also been very involved in teaching nationally. Namely, I've really been very involved in a new reconstructive technique for the knee, and I've been asked to go teach that several times. I've really enjoyed that part because it's fun to talk to people. And what I found is not only am I teaching, but I'm there with other people who are kind of national leaders. I've learned a lot. And so being able to teach and learn at the same process, it's been great. You know, I really went into medicine because and it's always such a overused statement, but I realized I loved sports, I loved medicine, I loved the science behind medicine, but I really like helping people. I think what I like the most about orthopedics is it gives me a chance I can work with children, I can work with elderly, I can work with anybody that comes in for different reasons. And so it's a good variety, and the vast majority of people you make a lot better. And that part of it is being a doctor is fun.